So, good evening, everyone. I welcome you back again to the second section of this training of the International Executive Diploma Certificate in Adolescent Behavior Management. This is the second session we shall be having. But before we proceed, we like to explain some few things that are very important because while we lectured last time, a lot of people have been calling me asking different questions, and it's more reason why I would like to go back to explain tonight. I know that those things people were asking for. They were asking what are the benefits or the importance of studying this course, of taking this course, and if I earn this certificate, excuse me, and if I earn this certificate, what and what am I going to benefit, and where exactly can I use this certificate to work? That's why I prepared about 10 slides or 10 or 15 slides to explain this tonight, and after that, we shall move briefly to what we want to discuss. And I want you to get ready. Sorry. And I want you to get ready. So somebody should please mute the mic, please. Mute your mic. Now, the first thing I want to talk about tonight is your benefits or the benefit of studying adolescent behavior management. Either you are an individual, a parent, an educators, and caregivers. So now when you are talking about studying adolescent behavior management, we are saying adolescent behavior management can provide individuals with valuable skills and knowledge that are beneficial in various personal and professional contexts. Now, context. Also, studying adolescent behavior management can provide individuals with valuable skills and knowledge that are beneficial in various personal and professional contexts. Here are some of key benefits of taking a course in adolescent management, in adolescent behavior management. Number one thing you are going to get is that you are going to have deeper understanding about adolescents. That is, you are going to gain a deep understanding of the physical, emotional, cognitive development of adolescents. So you're going to get a deeper understanding of the physical, emotional, and cognitive development of adolescents. This is crucial for anyone working with or parenting adolescents. I've said it there as a parent. The studying of this course is going to help you to get a deep understanding of the physical, emotional, and cognitive development of adolescents, because this knowledge is crucial for you. Another thing that is benefit of studying this course is that it will give you understanding of effective communication skills. So, learning effective communication strategies tailored to unique needs of adolescents, and this includes techniques for active listening. There are so many people, they don't have listening ears, but this training is going to help you to have this lifestyle of listening, or the techniques of listening. Another one is that conflict resolution, and helps you again to fostering positive relationship. The number three thing of the benefits is that which I call behavioral intervention strategies. You are going to have the knowledge or the understanding of behavioral intervention strategies. By acquiring practical tools and strategies for managing and intervening in challenging adolescent behaviors. This includes techniques for behavior modification and escalation. Number four benefit. So that is, I call it prevention of risky behaviors. It will help you, the caregivers, parents, educators, to know how to prevent risky behaviors in adolescents. So learn about factors that contribute to risky behaviors in adolescents and explore preventive measures. This includes strategies for substance abuse prevention, violence prevention, and mental health promotion. That is number four benefit that this course is going to give to you. I hope you are following. Number five of the benefit of studying this course or going through this training. Yes, let me use the word, be using the word of training. Is that we are going to have development of empathy and compassion. That is, we're going to develop skills to empathize with the challenges and emotions that adolescents may be experiencing. This can enhance one's ability to provide support and guidance effectively. Because whatever you don't have, you cannot offer. And whatever you have not mastered, you have not mastered, you can't dominate or you can't rule, you can't be an authority over it. So, this training is going to give you these skills to be able to empathize with challenges, emotions that adolescents may be experiencing. So, about 6 benefits now. So, I want to believe that after this, nobody will chat, call again to find out about the benefits he or she can get by going through this training, because going forward, the video of the training will be made available. So, number 6 benefit you're going to have by going through this training is it will help you to know on how to promote or help in promoting positive mental health. By gaining insight into promoting positive mental health and well-being in adolescents, this includes understanding common mental issues and how to create a supportive environment for them to overcome it. The next one, which is number 7, is crisis intervention. So when they have crisis, this training will enhance you to know how to respond effectively in crisis situations, such as dealing with emotional crisis, self-harm, or other urgent concerns. Acquire skills for providing immediate support and facilitating appropriate intervention. Number 8, the knowledge of this training will help you to have about educational environments. And this benefit from knowledge applicable in educational settings, including strategies for classroom management, understanding diverse learning styles, and creating a positive learning environment. So by going through this training, we are going to get the knowledge that is applicable in educational settings. What somebody would travel to the tertiary institution to study guidance and counseling for good 4 years, or somebody who just went to university to study psychology. But it's just a fractional part. But here we are looking at different areas that the knowledge of this training is going to give every single participant. Number 9 is for the parenting and finally family dynamics. Understanding the dynamics of family relationships during adolescence and gain insight into effective parenting strategies. This can be beneficial for parents, educators, and professionals working with families. Number 10 benefit of this training will help you to develop a cultural competence to work effectively with adolescents from diverse backgrounds. From what? From diverse background. Because when we are talking about cultural competence here, we have so many cultures, even in the black race, among the black race, we have so many cultures. Let alone now adding Western world into it. So the knowledge of this training will help you or will keep you to develop cultural competence to work anywhere in the world. Because this includes understanding how cultural factors may influence behavior and communication. So another thing is just going to help you to have what I call professional development. It enhances your professional development and broaden your skill set if you work in fields such as education, counseling, social work, or youth services. This is going to be useful for most of us who are pastors, who are church counselors or just counselors, or social workers. Most times, most of them work in a psychiatric hospitals or they work in hospitals and any youth organization. So the knowledge of this training will help you to be able to contribute to the well-being of communities, that is community impact, by promoting positive adolescent behavior. Individuals trained in adolescent behavior management can play a vital role in community outreach and support programs. Career opportunities, specialized knowledge in adolescent behavior management, and can open up career opportunities in fields such as education, counseling, youth services, social work, and mental health. So this course, the knowledge of this training is going to give you career opportunities. Because if you are somebody who doesn't have a background knowledge in education, this certificate is going to serve as an added advantage to whatever qualification you are having to teach in a school settings. So, in summary, studying adolescent behavior management equips individuals with the tools and insights needed to navigate the unique challenges of working with adolescents, fostering positive development and contributing to the well-being of this age group. All of this is what I've put together for you to know the benefits and the importance of this training. You may not know the good you are doing yourself now by going through this training and after that paying for the certificate until when the opportunity opens for you. That is when you will appreciate it. But somebody who value education, somebody who believe that learning is endless and there is nothing that you learn that is a waste, that there is no certification you have that will be useless. You know that it is very important to pay attention, and same time at the end of the training you pay to get your certificate. So that is that about your benefit. Now, where can you work? Now, where can I work with this certificate? If I did not go to any contemporary school to have any certificate, but I'm having this international diploma certificate. So where can I work? By having this certificate in my hand, can I get a work with it? Even though I have my SSC, can I work with it? So let's see. Now, where can I work if I participate in the training? I want to congratulate you for participating in this training and for paying for certificates, because you have done yourself a good. All right. If you study a course in adolescent behavior management, you can potentially work in a variety of settings where your knowledge and skills in understanding and managing adolescent behavior are valuable. And I can bet it with you there is nowhere in the world where we don't have adolescents. Nowhere in the world. And if you look at them, the world, you discover that this set of age brackets are the ones who carries the larger percentage of the population. So you should rest assured that you are carrying a certificate that's worth the millions of dollars. Yeah, some of the potential work environment. Number one, I call it schools and educational institution. You can work as a school counselor with this certificate. 2, under schools and education institution, you can work as a behavior intervention specialist or educational consultant to support students in managing their behavior and promoting a positive school environment. That is one. The second place where this certificate is needed is youth services organizations. Youth services organization. Sorry, excuse me. Employment in organizations dedicated to youth development, such as youth centers, after school programs, and community outreach initiatives. You can work in this organization with yourself. And number 3, working environment is mental health clinics. Somebody is saying, I'm not a neurosurgeon. I'm not a psychiatric doctor, but I can bet it with you, quote it anywhere, check it anywhere in the world. Work as a mental health professional specializing in adolescent mental health by providing counseling and therapy services. That's what you do with this, is what you will do in this kind of working environment, mental health clinics. Number 4 place where this your certificate is useful is residential treatment centers. Residential treatment centers. Employment in facilities that provide residential treatment for adolescents dealing with behavioral and emotional challenges. Another place where you feel you can work a community health centers. Work in community health settings, providing support and resources for adolescents and their families. So that some communities they set up community health centers. So your service is needed in this area. Social service agencies, employment social service agencies that focus on family support, child welfare, and community outreach. You can as well work in juvenile justice system. Work within the juvenile justice system, providing support and interventions for adolescents involved in legal issues. And you can as well work in non-profit organizations. Opportunity in non-profit organizations that address issues related to youth development, behavior management, and community engagement, like UNICEF and United Nations. I was once a volunteer of United Nations. So you're going to work in all these places with your certificate. And as well, you can work as a private practice person by establishing a private school. Sorry, by having a private practice as a counselor, a therapist, specializing in adolescent behavior management. And two, you can work in school district as well. Employment within school district in roles such as behavior specialist, school social worker, or school psychologist. You can see all the benefits of rolling out in this training. And at the same time, educational consulting. You can offer consulting services to schools, parents, and organizations seeking expertise in adolescent behavior management. You can see. Also, you can work with organizations that provide parenting education support programs, helping parents to navigate challenges associated with adolescent behavior. Another place you can work is to work opportunities in facilities that focus on substance abuse, okay, treatment for adolescents, providing counseling and support. You can also work in this organization as it is known, employment and program design to encourage and support adolescents within the community. So the last one I'm going to mention, you can work as a researcher and an advocacy and organization. So research and advocacy organization. So you can work in this type of organization with your certification. Work in organization focused on research and advocacy for adolescent mental health and behavior issues. The specific opportunities behavior to you may depend on additional qualifications, experience, and regional requirements. Additionally, networking, gaining practical experience through internship, and staying informed about developments in the fields can enhance your job prosperity in adolescent behavior management. So that is where I'm going to be putting an end to that. So I want to believe as from this moment, nobody will have reasons to call or to send messages on where you can work with this professional certification and the benefits you attend to have by going through the training. Tonight, I will talk with this remaining 26 minutes I have on what I have for you tonight on behavioral theories and models. Behavioral theories and models. So, under behavioral theories and model, I'm going to discuss on three subsections under it. The first one is behavioral theories, the theorists, and their application to adolescent behavior. Two, I'm going to discuss about social learning theory and observation learning. And I will talk about cognitive behavioral approaches in understanding and modifying behavior. Under behaviorist theorists and the application to adolescent behavior, we're going to look at four things. The first one is just the behavior overview aspect, and we're going to check the classical theories of conditioning. And we have two theorists who propounded this. From there, we're going to consider operant conditioning, and this is done by what I called the Skinners. While the previous one mentioned the classical conditioning is propounded by Pavlovian. While the last thing we're going to look at under that is application to adolescent behavior. So we check behavior modification. So under the social learning theory and observation learning, we're going to look at social learning theories, which is propounded by one of our great scholars, Albert Bandura. And also, we look at the observational learning by roles of models, like what is commonly heard from our young ones or people that they will say, I have role model that I pattern my life after. It could be a pastor, it could be a professor, or somebody who is in one career or the other that you can pattern your life and your lifestyle with. And we check again imitation and identification. So we're going to look at that imitating behavior and application to adolescent behavior. So that is media uh, lifestyle. Under the cognitive behavior approach I mentioned the other time, we look at four things as well. We are going to check cognitive behavior theory. We're going to check integration of cognition and behavior. And we're going to look at cognitive restructure. That is challenging, where we're going to have changing negative behavior or thoughts. And lastly, under that, so three, sorry, is we are going to look at behavior modification techniques. What are the behavior modification techniques? So here are things we're going to learn tonight. So without further ado, I will like us to be checking it one after the other as we move. So under the behaviorist theories and the application to adolescent behavior, the first thing we are looking at here is a behaviorism overview. And let's just look at the definition, and which says is a psychological perspective and a school of thought that focuses on observable behaviors and external stimuli rather than internal mental processes, such as thoughts and emotions. It posits that behavior is learned through conditioning and reinforcement. I repeat, behavior is learned or formed through conditioning, and reinforcement. It emerges as a dominant force in psychology during the early 20th century, with key figures like John B. Watson and B.F. Skinner playing a prominent roles in its development. That is under the behaviorism overview. Let's proceed. So we move to classical conditioning under the behaviorist theorists and their application to adolescent behavior. So under this, we have a philosopher and a psychologist named Ivan Pavlov. He's a classical theorist. And he says that conditioning theory involves associating a neutral stimulus with an unconditioned stimulus to elicit a conditioned response. And in the context of adolescent behavior, these could be associations formed between certain stimuli and emotional responses. Now I move to operant conditioning. This is propounded, or this was propounded, this was propounded by or developed by B.F. Skinner. And he says that this involves reinforcing or punishing a behavior to increase or decrease its likelihood of reoccurrence. That is an adolescent. So he propounded it. That is operant conditioning. That we call reinforcement. And don't forget, we have two types of reinforcement. The first one is negative, and the second one is positive. Right? We're going to look at it as we proceed as well. So, B.F. Skinner theory involves reinforcing or punishing behaviors to increase or decrease their likelihood of occurring. So, where it says we have positive reinforcement, negative reinforcement, and punishment play roles in shaping adolescent behaviors. So, he now gave us these types of ingredients we can use to shaping the behavior of adolescents. So, number one is positive reinforcement. Is what? Positive reinforcement. Now, this is a concept in operant conditioning, which we know that it was developed by B.F. Skinner, and it focuses on how voluntary behaviors are strengthened or weakened based on the consequences that follow them. So, this positive reinforcement involves the addition of a positive stimulus to increase the likelihood of a behavior occurring again in the future. When a child of the age 10 to 21, we have explained, because we have three categories of the adolescents that we will look at on Tuesday. So we have that. So, and don't forget, if a child brings home assignments and he or she completed the work on time, so such a child should be commended. And that's what we call reinforcement. You can give a gift. You can say some sweet words to encourage such a child, and we make that child to continue in that same act. Let's proceed. So, key components of positive reinforcement. Now, I want to look at key components of positive reinforcement, where I have positive stimulus. That is reward, as I've explained in my explanation. I said a positive stimulus often referred to as a reward, and it is presented immediately after a desired behavior. So, good boy, enjoyable outcome. So, another thing I have under the key component of positive reinforcement is strengthening behavior. This positive reinforcement will strengthen behavior. You can see the purpose of positive reinforcement is to strengthen or increase the probability of the behavior that precedes it by associating a positive outcome with a specific behavior. So, individuals are more motivated to repeat that behavior in similar situations. But with the knowledge of this training, you will know that if you are privileged to work in all these organizations we have mentioned, so it's going to go a long way if you are applying all these principles you are being taught or you are acquiring now, which is going to help you to have a smooth running in your job or your duty. That is the word. So, example, I said a student consistently completes their homework on time. You can see that. So, positive reinforcement, the teacher praises the students and give them extra free time or a sticker. So, the student is more likely to continue completing homework on time because they associate it with what? Positive consequences. That is what will happen. And when a child brings in a certificate and says, okay, maybe this time in the class out of the 25, first position, he came out with first position. So what will you do? You help such a child with positive stimulus, giving a reward. You can take them out for a nice treat. You can praise. You can promise. Okay, you can say, okay, you come first, I'm going to take you to United States of America when you are having your holidays, and you fulfill it. Such a child to be more dedicated to his or her studies. So that is just about that. So, still under the positive reinforcement, but now we're going to put everything together under positive reinforcement. And this is how it goes. One, in everyday life, positive reinforcement is used in various settings, including education, parenting, workplace management, and behavior modification programs. So, it is an effective way to encourage desired behaviors by creating a positive association between the behavior and a rewarding outcome. Therefore, positive reinforcement is based on the idea that individuals are more likely to repeat behaviors that lead to favorable consequences. That is that on positive. So, quickly, we're going to look at negative reinforcement. And this is another concept under operant conditioning, which was developed by Skinner as well. So this negative reinforcement involves the removal or avoidance of aversive, that is, unpleasant stimulus to achieve the same goal of increasing the likelihood of a behavior occurring. If a child does something that's not good, you can pull the hair, twist it. Next time, he or she will be afraid to repeat such behavior. Now I want to look at key components reinforcement. Number one, I have aversive stimulus, and this is an aversive stimulus is uncomfortable that an individual seeks to escape or avoid. Most times, children, they always run away from being scolded. or from scolding. You understand? Many of us, so we're growing up, we don't like it to our parents or our elderly ones, our guidance to scold us. You understand? So, second is the behavior. Individual engages in a behavior that leads to the removal or abundance of their passive stimulus. Three, it strengthens behavior as well. So the removal of avoidance of the aversive stimulus serves to strengthen or increase the probability of the behavior that precedes it. So the individual learns that engaging in a particular behavior leads to relief from an unpleasant situation. Now I have another one I have here is example. That is, a person is seated in a noisy environment. So the loud noise is aversive and uncomfortable. So, and the negative repercussion is that the person puts on noisy or noise cancelling earphones behavior to escape or avoid the loud noise. That is aversive stimulus. So the outcome is that the person is more likely to use noise cancelling headphones in similar noise situations because it provides release from the aversive stimulus. Note, negative reinforcement is not the same as punishment. No. In negative reinforcement, the aim is to increase the likelihood of a behavior by removing or avoiding something unpleasant, whereas punishment aims to decrease the likelihood of a behavior by introducing an aversive stimulus. It is important to note that negative reinforcement focuses on strengthening a behavior, not punishing it. So the behavior is reinforced by the removal of something undesirable. So we just want to move on. We quickly rush down on the meaning aspect. We have to look at that is say under application to adolescent. The application to adolescent. Here we have behavior modification. So behavioral principles can be applied to modify and shape adolescent behavior in educational settings, emphasizing positive reinforcement for desired behaviors and the consequences for undesired behaviors. So the second is as social learning, like as I've explained, social learning theory and observational learning. Under it, I said we're going to talk about social learning theory overview. That is by this is which was propounded by Albert Bandura. Social learning theory posits that individuals learn by observing, can see, and that's just learn by observing others and imitating their behaviors. That's most time what our children, that's what they do. Once they observe what you are doing, they are going to replicate what you have done. They're going to repeat the same thing back in a couple of minutes, even to your eyes while you are still there. So, imitating their behavior. So, and vicarious learning are key concepts too. Under social learning theory and behavioral learning is that we have observational learning. This observational learning, unlike we have what we call role models. Role of models. By observing their behavior of role models, you can see this thing is very, very common among our musicians. We are seeing nowadays. One will say, I want to pattern myself towards Davido. Another one will say, my music Christian side and those in the other contemporary music. So that is how it goes, you understand? Right. So, role of models. Adolescents learn by observing their behavior of role models, including peers, parents, and influential figures. So there are particular people that can serve as role model to people. Because somebody may pick his peers as role model, and he could pick parents as role model and influential figures. Somebody will say, I've been studying the lifestyle of Elon Musk, so I want to pattern my life according to his lifestyle. Another person will say, I've been looking at this man. What is his name now? Maybe I'm looking at Joe Biden, or this man, the former president, before yes, so Barack Obama, yes, you understand. So all of these things are what we call role models, and these are the agents that we use. So observational learning occurs through attention. How do you do that? By paying attention. By doing what? By paying attention. And if you as a guide or a caregiver, to be able to know the way a child or adolescent behave, you have to do what? You have to pay attention. So for you to be able to what? To pick what you are going to develop on to manage such a person's behavior. So another one is retention, reproduction, and motivation. So number 3, under social learning theory and observational learning, we see imitation and identification. So imitating behaviors, adolescents are more likely to imitate behaviors they find rewarding. There are some of them which have not been grown up, they will not be able to differentiate the one that is good for them and the one that's on the negative side. But it's the duty of you as a caregiver or educator or behavior manager or management specialist to be able to do that for them that are associated with positive outcomes. So identification with models are perceived similarities, also influencing observational learning. So number 4, application to adolescent behavior, that is under media influence. Social learning theory helps explain how media influences adolescent behavior through the portrayal of characters and behaviors. So educators and caregivers can leverage positive role models to encourage pro-social behavior. So the last one, now, let me just use 2 to 3 minutes, extra 5 minutes to do that, to do justice to that. Right. I'm having cognitive behavioral approaches in understanding and modifying behavior. Number 1, cognitive behavior theory overview. Number 2, under it is cognitive restructure and behavior modification. Let's quickly rush through it. Now, integration of cognition and behavior. Now, cognitive behavioral approaches integrate cognitive processes, thought, behavioral principles. So Albert Ellis and Hiram Beck are key figures in the development of cognitive behavior therapy that we call CBT. Not the kind of CBT they use in exam center they go to do right now. That's what we call CBT. Cognitive behavioral therapy. Cognitive behavioral therapy. So number 2 is cognitive restructuring cognitive restructuring. Cognitive restructuring. That is changing negative thoughts. Adolescents may engage in negative thought patterns. So, cognitive restructuring involves identifying and challenging these negative thoughts, replacing them with what? With more positive and realistic ones. So, behavior modification techniques. Now, we have application of cognitive behavioral approach incorporate behavior modification techniques to address maladaptive behaviors, which includes setting goals, that is, I'm talking about behavior modification techniques, setting goals, using reinforcement, and implementing strategies to we are going to be drawing a curtain as application to adolescent behavior, which is coping skills development, CSD. So CBT is used. Don't forget what CBT stands for. Cognitive behavioral therapy is used to teach adolescents effective coping skills, problem solving strategies, and emotion regulation. It helps them manage stress, anxiety, and challenges in a more adaptive manner. In conclusion tonight, understanding and applying these behavioral theories and models provides educators, therapists, caregivers with effective schools tools to comprehend, to influence, and more. So these approaches contribute to creating positive learning environment and supporting adolescents in developing adaptive behaviors and coping mechanism. So tonight, this is where I'm going to be drawing a curtain. Wow. This is where I'm going to be drawing a curtain to read. Wow, it stops. So I've been talking without sharing screen. I'm so sorry, guys. So you have the audio to listen to, and at the same time, you have the slide. So I'm going to drop this. So I'm going to be putting an end to it tonight. Thank you very much for coming along. I can see Victoria here. I can see Olawale. So I know others would love to, to listen to it. Thank you very much for coming. Do have a wonderful night rest. So we see. Till we meet again. Thank you. Bye for now.